So there's good news, then there's bad news, then there's good news, and then, well, you get the picture. The pandemic rolls on, and we're seeing what some call a resurgence. This pandemic roller coaster has taken another bad turn. Well, Patty, I guess we need to talk about this and see what we can do to help the cleaning industry, those involved with ISSA and GBAC, to deal with this situation and build confidence in those they serve.
Absolutely. It's coming down to, the acceptance that this is probably going to be around for a long time. And with that, what do we need to do as individuals, to be able to stop or to be able to protect ourselves, our workers, our employees, our customers, and really our communities as well. And in some respects, I hate to say this, but it comes down to mathematics and, the numbers games. And, it's one of those things that can explain some things for us when we look at what we need to do.
Yes, and I know people want answers. Sometimes those answers are difficult to figure out, but let's have Dr. Gavin Macgregor-Skinner join us today, and let's go over a few points that our industry really needs. Well, Gavin, thanks for joining us today. Maybe we could start off with a quick overview. What's going on out there? Have you been traveling? I know Patty's been to a conference. Gavin, what's up?
Oh, hi, Jeff. Hi, Patty. So yes, COVID-19, the disease is still out there. It's still caused by SARS-CoV-2 virus. No matter what variant you call this, it's still COVID-19 disease. That hasn't changed. And so all the risk mitigation solutions that we've been talking about now for a very long time, months, still just have to happen. People just have to realize you still have to do the things that you've been doing and continue to do them. So sustainability, consistency is the big issues at the moment, Jeff.
And what about you, Patty? I think you were at a conference recently too. What's it feel like? What's going on out there?
Well, I think what we're seeing right now is a lot of confusion. What do they need to do? And also we're seeing a lot of pandemic fatigue. And, as Gavin indicated, we still need to be doing the things that we have been practicing here for the last year and a half. But this disease, the SARS-CoV-2, is here to stay for a while. And it's hard to accept that, but we really do need to understand that it's not just going to go away. And not only do our businesses need to do their part, our governments need to do their part, but we as individuals need to do our part as well.
Yeah. Any thoughts or indication on how long this might go on? I know there's no way to pinpoint it, but this is molding the cleaning industry, isn't it? We're doing things, we're responding, but are we talking about perhaps years? And how will that mold and focus us as an industry?
Well, Jeff, everyone should really realize that COVID-19 should have ended by now. The reason it hasn't ended right now is because we have a mutation. It's called the Delta variant. It came from the country of India. It should have stayed in the country of India, but it left the country of India on a plane. And that plane landed at an airport. And it now has gone to over, 120 countries, I think it is, where we've got Delta variant. And then it came to the US on a plane through an airport. And then people that were sick, that had symptoms or infected, kept traveling, and they didn't do the right thing. And they traveled and they traveled and traveled. And now we have this Delta variant as the dominant variant of the SARS-CoV-2 virus in all our states. It's increased our hospitalizations. We're also seeing an increase in the number of deaths now in those unvaccinated people. What we're not seeing, and this is the good news is if you are vaccinated, it's highly unlikely that you would end up in hospital, and very, very rare that you would die from this disease if you've been vaccinated. So the movement of people is still our enemy. It still is what moves any infectious disease. But right now, you asked what's going on right now, Jeff. I've been to 2 conferences in the last couple of weeks, and it was the absence of the cleaning teams, the janitorial staff. I have not seen them at any conference. I haven't seen them in any hotel. During when I would expect to see them. This is when people are moving around. And then we had a good discussion at airports, convention centers, and stadiums. And the big risk factor was people getting into indoor spaces and crowding. And they actually had mapped this out and said, oh, look, here are the times of the day when we had lots of people, lots of crowding in an indoor space. And I said, great. What did you do to mitigate those risks? or nothing. We don't clean until the nighttime, or we don't clean till the early hours of the morning. And that's wrong.
I was at a conference a few months ago, and the cleaners were in evidence. They were there after every session. Gavin, you were there with me. They were wiping things down, disinfecting. Maybe it was just that one conference, but yeah, you're right. We need to build confidence in those we serve. And if we're not seen as a cleaning industry, then they don't know what we're doing.
You're absolutely right, Jeff. I mean, and I've seen on both sides. I think that there's been some confusion when the experts out there from CDC, make a statement of this is primarily airborne. A lot of people are like, oh, I don't need to do anything else. So I don't need to. And sometimes it comes down to money. I don't need to spend that extra money for cleaning and disinfection. The fact of the matter is that from a biosafety, I'm a biosafety professional, and I provide support to those individuals like at CDC who are doing that research, or in hospitals who are caring for those patients. And from a biosafety standpoint, we know that there are layers of potential infection, or there are different types of modes how people can become infected. We know that SARS-CoV-2 is primarily an airborne virus, but we also know that contaminated surfaces can be, that vehicle, that way that people can become infected as well by touching it. And as Gavin would put it, touching our holes, our eyes, our nose, and our mouth. And when we look at that, we don't know the percentage. Again, this comes down to mathematics a little bit. We don't know the percentage of individuals who become infected by airborne, or who become infected by, touching a surface and then touching their eyes, nose, or mouth. And that's critical, because if you look at the millions and hundreds of millions of people that have become infected, there is going to be a significant number who become infected by what we would call surface contamination or fomite transfer. Our phones are what's considered a fomite. And, it is that vehicle that can transmit or transfer the virus as well. So cleaning, sanitization, disinfection are extremely important. And that scalable response, number one, make sure that we're cleaning right, not just for it looks pretty and smells nice, cleaning correctly, and then, and during times of need and high risk, scaling up the disinfection steps as well.
What are we seeing with air cleaning, air purification, UVC, air scrubbers? I know that the cleaning industry that we represent, they're doing a great job with what they do. They know how to clean, disinfect. What about the air? We mentioned it. What do we do about it?
This is really interesting, Jeff. I gave a presentation yesterday, and I was surprised that all the questions I got was something I didn't cover in my presentation. And it was just what you said, HVAC systems and air quality. And I thought, okay, wait a minute, let's put this out to the audience. Now, you've all come into this ballroom to hear me talk or hear the other presenters talk at this conference. You've paid money to come to the conference. Now you're asking questions about the quality of the air. What questions do you have? And it was really interesting because none of them had said, did anyone take any air samples before the conference? Is anyone taking any air samples during the conference when the ballroom is crowded full of people and we're there for hours in the day? Is anyone looking at the movement of air? Is there turbulence in the air? Is there unidirectional airflow? And everyone went, oh, maybe the HVAC system is going to save us. And I said, what do you know about the HVAC system in this ballroom where I'm giving a presentation? Did you ask any questions? And they just said, well, we don't know what questions to ask. And so there's this huge empty, this is big hole at the moment in our knowledge, in our understanding when it comes to, UVC lights, air scrubbers, HVAC, the number of times that the air needs to be changed or should be changed in a room. No one knows that. But more importantly, the fact that no one asked the question, what is the air quality in this room? Is there particulate matter? Is there allergens? Is there mold? Is there viruses, particles in the air? But they're all very happy to sit down for a 2-hour presentation and sit there comfortably and listen to us talk and tell me the biggest worry was the air quality.
Yeah, and that's very interesting. And what we've done in GBAC is we have a group of experts who are looking at what is currently being recommended, just all the way from indoor air quality considerations that we've looked at in the past, temperature, humidity, molds, mildews, that kind of stuff that you typically would look at when an indoor air quality concern would come up, to now what we are needing to look at from a standpoint of, a virus such as SARS-CoV-2. Gavin alluded, and he's absolutely right. There's so much out there right now, and it's so confusing, and it really, a lot of science, that's part of it, a lot of physics. When you're looking at, how many air turnovers do you need in a specific room? How many square feet are in this room? Is it volume? Is it, what we call single pass air, or is it a recirculated system? And what does that mean? What we're finding is that there are a lot of pieces of equipment, and they are tied to the cleaning industry as well, that are starting to come to the market, and that we've been working with different folks. Some of it is also confusing because of the regulatory framework that we have here in the United States. So you'll have something like a UVC light. First of all, it's not a magic blue light. I mean, you have to touch a surface for a certain specific period of time for, and within the right wavelength. If you don't do that, then it's ineffective. So it can be very effective, but yet it has limitations. You have things that are, we'll say, air filtration devices that maybe use a MERV 14 or MERV 15. What does that even mean? Or a HEPA filter, and it will, filter the air and then, put it back out into the area. Okay. How many times does it change the air in the room? How big is your room? There's a lot of questions that need to be answered. And then we have some really unique pieces of equipment that are now devices. And these are very confusing for folks because we've been looking at different ones. Some of them, are the hypochlorous acid generators that we've been hearing about, those showers that people walk through. We've also seen things where ozone generators or dry hydrogen peroxide generators. Sometimes, you can be in an occupied or unoccupied. And then we're starting to see there's a new system out there that EPA gave an emergency approval for, and they're the only one so far, for literally viral disinfection of the air. And that's now been approved in, I think, about 8 states. And so it's very confusing. And I think on the positive side, it's also potentially very exciting because it is something that, we're not looking for a sterile environment. We're looking for a healthy environment and a hygienic environment.
So would it be safe to say that air cleaning, purification of air, creating a cleaner air in buildings is the new frontier?
Absolutely. I think you're going to see, I know you're going to see, we're going to be doing, we're actually talking about, having, along with the white paper, for air considerations, especially for our STAR facilities and our STAR service providers, also potentially a GBAC summit, and maybe that'll be our kickoff topic. That it's the new frontier, air cleaning.
So one other thing I want to touch on is in the news you hear cities, companies are mandating that you be vaccinated. One major city in the U.S. is saying that soon to go into buildings, to go to a movie or to dine in, you have to show your vaccine passport or your CDC card. What can the cleaning industry do along with that? Can cleaning companies use workers that are vaccinated and use that in their marketing, or organizations use it to build confidence in those they serve? Do you see that happening?
Yes, I do, Jeff. I do. I think the communication of not just the customers or the patrons that visit a convention center, a stadium, a performing arts theater, or people who go to a hotel or an airport, they need to know now, again, what are the solutions what are the mitigation solutions for risk, but more importantly, what are the employees doing? And I think what we're seeing, again, you and I have been to conferences together, Jeff. I'm at a conference, Patty's been to a conference. What the common theme or the common denominator that I'm seeing at all these conferences now is that better communication about what they're doing or what they're trying to do. QR codes are everywhere. I don't think I've touched, at this conference here, it is a no-touch conference. I haven't touched anyone and I haven't touched anything. And so whenever you come in the morning, you do a QR code, you do a health check, and then you get your temperature taken with no-touch technology. And then you get a band on your hand, which tells you this is the color of the day, and you can now go into the sessions. So that's not going away anywhere. But more importantly, we are discussing, and we have been discussing it at the previous conference I went to and this conference, about proof of vaccination or proof of why you can't get vaccinated but still want to attend, and what we can do to help you with the risk factors that you may face. So we're seeing lots of no-touch technology, but more importantly, I'm starting to see that a lot of the people who attend stadiums, performing arts centers, hotels, airports, their biggest concern are restrooms, bathrooms. And that visualization of what you're doing in a bathroom. What are the operational procedures? How often you clean them? And even at this conference, Jeff, there's feedback. There's the little smiley faces that are red. Oh, they're not all smiley, are they? There's a red, there's a yellow, there's a green face. Well, they're there, and that then triggers an operational requirement or an operational decision point when people keep pressing the button. And I think it's like if they get 5 red buttons in an hour, that means they have to make a decision and do something based on what that red button was being pushed. So it may be a dirty area. It may be the trash hasn't been emptied. It may be the hand sanitizers run out of hand sanitizer. But I'm seeing these traffic light systems, these buttons all around, and that leads back to a dashboard, and that leads back to the janitorial or the cleaning team or the other employees to respond.
Yeah, times are changing. I know that even though we're in the cleaning industry, we're also consumers. And when we travel and see things, we have confidence in what we see, what we experience. And so I do appreciate, Gavin, those comments. And I like seeing the accountability that's given to those that take care of buildings, because it just means there's more confidence put in us when we do our job right. Patty, what do you think?
Well, I mean, Gavin brings up a really good point on a couple things. And number one is, Gavin and I have prepared, and our team has prepared our whole careers to be able to, sort of like that emergency medicine physician. They train. They hope they never see somebody get hurt. But when somebody is hurt, they're there to provide that support. And Gavin and I have, we go back many, many years, and we don't want to talk about how many, but a lot of years, and have traveled all over the world together. What we find is that we have a passion for working with people and helping people. And whether it's our ISSA vendors, we get excited about working with them and seeing what they have to potentially offer the communities and employees and people and the solutions that they have. Working with our STAR facilities and our hotels, our airports, our convention centers. It's very fulfilling for us to be able to help people. And that is something that we really have been doing this last year. The vaccine passports are kind of interesting because, first of all, they don't like them. A lot of folks don't like to call them passports because there's a regulatory part of a passport that's required. But here's one of mine, or here's my vaccine record. And so what we're doing is within GBAC is we're actually talking with a couple different groups about what is it that you can provide? And the key thing, and this is a concern for a lot of people, is if I'm a convention center and I am going to require proof of vaccination, how am I going to record that and how am I going to document that? And there's a lot of things that come into play with that, with personal information and, working with some of these groups that already have all of those legal aspects in place is really important, which is why, we're looking at who can we work with to then help our facilities again with some of these challenges and solutions.
So Gavin, you mentioned you've been doing some traveling. What are you seeing out there? Anything you could share with us about what proves the cleaning industry is on the job?
Oh, Jeff, communication right now is so critical, so important. People want to know. So I'm seeing dashboards, but I've just seen something for the very first time in this convention center I'm at this week, and I've never seen this before. It is a photo of the bottle, the EPA registered list and disinfectant. It's a photo of the disinfectant bottle on the surface that's being used by that disinfectant. And if you want more information about the bottle, it has a QR code that you can use your phone that takes you to the manufacturer's website so you can read about it. And there's so many different surfaces that we clean and have to disinfect. But I thought this was fantastic to put a photo of the bottle of the disinfectant, which is EPA registered, on the actual surfaces. Say, well, this bathroom's being cleaned or disinfected with this product, and this other surface is being disinfected with this product. I hadn't seen this before, Jeff.
Interesting stuff.
That is absolutely, I guess creative, and Gavin's right. People want to know, and it provides us that, we'll say, confidence that not only are they doing what they say they are going to do and show that they're doing it, it then provides customer and client confidence. So that's really kind of cool. The interesting one that I've seen is that we're also, I guess in general, if you go into different places, you'll start to see the GBAC star symbol. And what we can with confidence say is that those facilities and those service providers that have committed to GBAC star and have gone through the accreditation process, there is a difference in those facilities. They understand, they're trying. Nobody's perfect, but they are actually out there trying to make a difference from a cleaning standpoint and a hygiene standpoint. The funniest logo that I saw where it was in the Minneapolis St. Paul airport. Was in the bathroom. As Gavin indicated, bathrooms are one of those places that if you have a dirty bathroom, it's in your mind, it's like, I wonder what the rest of the facility is like. I recently was at the Baltimore Convention Center for Destinations International meeting, and the Baltimore Convention Center did a fantastic job of communicating to to the people who were at the conference what they were doing. They had they had different banners up all over the place with the GBAC star symbol on them, which for me was quite nice to see. But they also had their cleaning staff out. Their cleaning staff was participating all over the place, making sure that high touch points were being taken care of, and were there in the event that they needed to step up and disinfect when needed.